This is a nice example from Jefferson County, Wisconsin, of how a Jefferson County elderly benefits specialist, Denise Grossman, is using the Elder Index. And she says very clearly here that about 23% of my clients live below the federal poverty level. It takes patience and creativity to look at the remaining 77% of my caseload and strategize with them about making their income stretch to cover their basic essentials. For some, it may mean selling their home of over 45 years and moving into a subsidized living space. The Elder Index gives us something tangible to explain to our clients why it is that they're struggling to meet their basic needs. And it helps us illustrate to our clients that it's not their fault. We've been very excited in California to have some success in seeing the Elder Index integrated into bills, into legislation. Our California partners in both 2009 and 2010 introduced the Elder Economic Dignity Act, which would have required the State Unit on Aging, as well as area agencies on aging across the state, to integrate the Elder Index into their strategic planning and how they target their services to those who are economically vulnerable. In addition, it would have required area agencies on aging to use the Elder Index as a measure of economic vulnerability in their case management intake, as opposed to the federal poverty level. Again, more accurately reflecting which elders are struggling to meet their basic expenses. This year it was reintroduced as the Elder Economic Planning Act. And I will say that this legislation moved far in 2009. It was sent to the governor's desk and then vetoed because of supposed cost pressures. And so it's really incumbent on us as advocates to illustrate the importance of this tool as a use for planning, as a use for evaluation and development, and as a tool that really holds our legislators accountable in terms of how they allocate scarce resources. But we're very hopeful that in 2011 the bill will get some traction. Also in California, they introduced the Economic Security Task Force legislation, which would have developed a 2-year bipartisan task force to create goals for reducing economic insecurity among Californians by 50%. And that bipartisan task force would have used concrete measures, including the Elder Index, to establish those goals. This is a nice example of how the Elder Index can inform program planning. At the Philadelphia Corporation on Aging, Dr. Alan Glicksman uses the Elder Index to illustrate for his clientele in the Philadelphia Corporation on Aging service area who is actually falling short of economic security. So with the goal of promoting economic security as a central focus, the PCA now uses 200% of the federal poverty level as its planning and research agenda, as opposed to 100% of the federal poverty level. And that's based on what they saw from the Philadelphia Elder Index. Also here, a really nice example of how the Elder Index can be a powerful tool for service providers in terms of doing evaluation. Paul Downey at Senior Community Centers of San Diego runs a housing and food assistance program. Using the Elder Index, he's able to demonstrate that his housing and food assistance services close the income gap for seniors by 34%. The Elder Index in San Diego, California is a little over $22,000. Through housing, subsidized housing, his seniors receive a $6,000 benefit. Through Older Americans Act Meals programs, a $1,700 benefit, and therefore $7,700 of their costs are covered, and they're able again to remain in their community where they want to be. The Elder Index is a powerful tool in terms of raising awareness. So far we've completed over 450 presentations. We've had over 180 media hits. I'm sure with Kathy at the helm that is going to increase exponentially in Washington. And we're using messaging in the Elder Index to really break down barriers to enrollment in income support programs. Our partners in both Massachusetts and Michigan use the phrases, "it's not your fault" and "you are not alone" in conjunction with the Elder Index data to show elders it's expensive to get by in your community. It's difficult to retire at home. And here are some income supports that can help you make these expenses more manageable. And this is a nice example of an outreach brochure from Michigan, done in partnership with Michigan AARP. Illustrates it's not your fault, and also includes information on where people can access their elder index data. And so finally, I should say that the elder index is very much a bottom-up initiative. We look to our state partners and our community-based advocates to help us establish our agenda at the national level. And so I want to close by talking a little bit about WOW's federal policy priorities. First and foremost, we're very interested in safeguarding Social Security. The data and information that I showed you earlier illustrates very clearly that Social Security is not enough, and cuts to Social Security benefits are not something that WOW supports. Therefore, we are a part of national coalitions to oppose cuts to Social Security, and we're also interested in ways to modernize Social Security, to make it solvent, and to ensure that benefits are strengthened for those who need them the most. In particular, in the short term, we're very concerned that the vote on the debt ceiling may include positioning that puts Social Security in a difficult spot. And so we will continue to reach out to all of you and to our networks across the country, encourage you to call your senators, call your representatives, and voice your support for Social Security and ensuring that benefits are not cut and that Social Security reform happens outside of a deficit context. Defending income support programs. We're all very, very intimately aware of the budget situation both in the states and at the federal level. And right now we're very concerned about cuts to LIHEAP, to the Section 202 program for the elderly, and also the community services block programs. The House budget that was defeated but does serve as the foundation for their proposals going forward, it would be devastating for people to have to live with these cuts. And so we continue to engage our network and hope you'll be a part of that. And then finally, in the long term, again, we really want to institutionalize these concepts. So I've been working very closely with a number of folks in Washington on institutionalizing economic security as part of the Older Americans Act, making economic security a primary goal of the legislation, inserting language that reflects what many state units on aging and area agencies on aging are already doing, which is using the Elder Index and local measures of economic need for strategic planning, collecting best practices through a resource center, and really expanding upon the great work that's already happening to make economic security central to what the Older Americans Act already does in a more concrete way using concrete language. And I'm happy to share some of that language with you, and I'm always seeking feedback on it. Also, we're very interested again in diversifying retirement savings. Our data makes very clear, as you saw earlier, the need to supplement Social Security benefits, and we certainly don't believe that Social Security should be the be-all and end-all for any given senior. We're really interested in some initiatives at the state level to implement universal retirement accounts. And we recently, there was legislation introduced in Illinois. There's been some traction in both West Virginia and Connecticut on opportunities to create essentially a 401k based program in the state government, administered by state government, that would be available for people who work for small businesses that don't have access to that type of program. It's a very efficient model, and it would create another savings avenue for people who don't have access to that through their employer. And finally, advancing long-term care and supports. Our data makes very clear, as you'll see, and as all of you know, that the cost of home and community-based long-term care in the private market is devastating. It's not sustainable for very many individuals at all. And so it's really important that employers and employees know about the CLASS Act, which was established through healthcare reform, and will create a public social insurance program that will allow today's workers to buy in and have access to some cash benefits for home and community-based support should they need it in the future. And finally, there are also many options available through healthcare reform for states that would incentivize rebalancing efforts. And I know that Washington is a trailblazer in this respect, certainly, and so we want to lift up the models in this state for other states that really do need to work towards rebalancing. So if I have done my job today, then you are completely convinced that the Elder Index provides to you new quantifiable support and new data and information to support the work that you're already doing to promote economic security in the state for seniors. You're convinced that we have an opportunity to bridge generations and bridge issue areas. The Elder Index and the concept of economic security really provides a foundation. It illustrates how the cost of basic expenses in housing, in healthcare, in food, in transportation connect. And the work that we're doing in our little niche areas really do impact one another. So it provides an opportunity for you to come around a concept and advocate in a more holistic manner. And finally, it provides the opportunity for targeted advocacy and targeted outreach. There's something for everyone in this Elder Index data and in this economic security concept. And so I hope you will take this data and information and use it in your everyday practice. And then more importantly, tell WOW about it. Being a part of this initiative, you have access to a national platform. And we want to spotlight what you're doing in Washington. We want to lift it up, and we want to see it replicated. So without further ado, I will introduce Allison so that you can see your data for Washington and invite questions after her presentation. Thank you.